Hello, and I'm speaking with Professor Adrian Schoo from Flinders University in South Australia. Hi, Adrian.
Hello, Melissa. How are you?
I'm really well, thanks. And you?
Yes, good, thank you.
Terrific. Adrian's paper, A Conceptual Model for Recruitment and Retention, Allied Health Workforce Enhancement in Western Victoria, Australia, which was published in 2005, is actually one of the 20 most cited articles of all time in rural and remote health. Congratulations, Adrian.
Thank you. Thank you. I didn't expect that.
No, it's terrific. I wonder if you could first give us a little bit of an introduction to the team that produced the article.
Well, at the time I worked at the University Department of Rural Health that sat between Flinders University and Deakin University, and basically my brief was to establish a professional development program for physiotherapists in the southwest of Victoria, in view that they were going then to stay in rural areas, and so that was then funded by the Department of Health, and that sort of slowly developed to a program for 22 different allied health professions in the state of Victoria. So that was it became quite large, and that was then accessed by different jurisdictions like Queensland and Tasmania, Northern Territory and South Australia, and also SERA, the Services for Rural and Remote Allied Health. So it grew quite large, and it had ongoing funding for quite a few years.
Wow. So can you give us a bit of an idea about what your article was about and why you think it did garner so much attention?
So, well, the article is basically still in the area of my interest, because recruitment and retention is complex. It is a complex issue, and you can look at it from different areas. And again, you can say, yes, access to professional development is quite an important issue, because especially a lot of professional associations really stipulate that their health professionals need to keep themselves up to date, so they get professional development points. But if they are located in a rural and remote area and don't have any access to professional development, then of course that might be one of the reasons that they move away from the area they work, and where we basically need the health workforce to address that inequality that exists. So that is one of the reasons. But what I wanted to outline in that model is it is not only access to professional development, it is much more. And if you dealing with a manager who is not capable of managing an organization quite well, that could be one of the reasons. And basically where it comes down to is retaining health professionals is very different than recruiting them. And you can recruit all people, but it doesn't mean to say that they stay. And of course, staying in a rural area is not related to professional issues. It can also be personal issues. But you can override those if you establish that invisible psychological contract that people want to feel that they make a meaningful difference. So that means it is really an interplay of different factors. But if you can enhance some of the factors that might help them to stay, that might override some of the factors you cannot influence, like their personality. I think children might grow up and they might want to go back to the city. So again, it is utilizing that, and I think that a lot of people still don't see that, and so including communities, for example.
Well, I see that with the papers coming through at the moment, that recruitment and retention are both still very big issues. So do you think there's been a lot of change since 2005, or?
Yes, there has been more development, but I still think that we need to go beyond rural education only. Say, I know for some of the professions, like as in the medical professions, there is now the rural pipeline.
Yes.
There's a lot of money being put into that, but I still think that we need to do more than just only selecting rural students into rural education, because we cannot expect that people will stay in a rural area if some of the other factors haven't been addressed. And that's the work that I do, for example, also with Professor Dean Carson, where we look at census data, and it clearly looks that people move around and they go from rural to rural. rural, that go from rural to urban, that go from urban to rural. And so it means that we don't only have to look at rural people, even though there might be more chance that they are interested in a rural practice, but also there are clearly people coming from a city who really quite well adapt into a rural environment and stay there. So I think really we need to look at that as well, and we need to acknowledge that it is really complex and that we have to address many more factors than only professional development and also rural education.
Yeah. So what kind of other factors do you mean?
Well, say, for example, also what we do at Flinders, and I'm sure that a lot of other universities do that as well. We really think, for example, in the PRCC program, where the medical students are immersed in rural area, is that we also actively engage the community. And we get some people in from the community who will introduce them to the different sporting clubs tell them where the ATMs are, which pub to go to and which one not to go to, things like that, you know.
Yep.
And that's one of the research, for example, what I did also with Karen Stagniti, who's now a professor at Deakin University, she was part of the team, where we looked at the big survey data and found that, for example, a simple reason like a poor induction program of new staff members is definitely impacting. If it's poorly conducted, it negatively impacts on retention. And you can see that because people are perhaps finding their way in an organization, they're not being linked to others. So I think good induction programs is, for example, another example that could enhance retention.
And is this the subject of your ongoing research, Adrian?
Not quite. I mean, basically what I do, yes, indeed you can say yes and no, but at the moment where I'm really sort of working on is to refine that conceptual model, and we just finished a commissioned paper that's been accepted for publication now, and that's where we really have refined the model, but it is really embedded in complexity theory, because again, as I mentioned before, it is really complex, and we have to recognize the different stakeholders. And in that conceptual model, I had sort of 3 domains, but we now expanded it to 4 domains. And in each domain, there are stakeholders who can be at odds, right? So it is about preparing health professionals to work in complex systems, to give them the skills also to like systems thinking, negotiating, but after all, also respect. You know, we need also to think about, and I mentioned in that paper, groupthink, for example, that some health professionals think that they are perhaps it's a confined group and think that they perhaps are more important than other groups.
Right.
In that sense, we never really get to true interprofessional patient-centered practice, right? So I think, again, it is quite complex. So I'm sort of working more in that area now at the moment.
It's really, really fascinating. Yeah, but why, the big crux of it, why are you interested in rural and remote health in particular, research in particular? Because I'm a rural person by background.
Yes. And of course people will say, yes, but you just told me you know that. But I suppose indeed having a rural background, of course, has got some influence. That's right.
Yes.
And so I was born on the island of Texel in the north of the Netherlands, in the middle of the North Sea.
Oh, wow.
I suppose half the size of King's Island, so everybody knows everybody. But I suppose that influences you to a certain degree, and I quite like rural areas in that sense.
Yes, yeah. Well, thank you for talking with me today. It's been really fascinating, and I wish you the best of luck with all your future research.
Thank you, Melissa. Wonderful.
Thank you.
Bye-bye.
Bye.